The next part of the exam I'm going to move to is the shoulders and the neck examination. I'm going to move your gown forward just a bit. I just want to palpate different parts of your shoulder, including the coracoid process, roll over the biceps tendon. Does any of this hurt?
No, it does not.
Okay, let me just palpate over the clavicle here too. Any of that hurt?
No.
This side? No?
No.
Again, same thing, you could just lift up your sleeve a bit. And be palpating, relax your arm to the side, palpating over the biceps tendon, the coracoid process, then follow over the AC joint. No pain?
No.
Good. Okay. And the next thing I'd like to do is to check the range of motion of your shoulders. So could you put, with your arms starting at your side, slowly make an arc and go with your arms above your head. Good. Now can you put your hands behind your head? Good. Next thing I want you to do is to put your hands behind your back with your fingers all the way up as high as you can. Great. So the internal and external, you can relax your arms. The internal and external rotation of the shoulders appears to be normal. Next I'm going to check the neck range of motion. And there's, of course, 3 different positions to check for this. So Nancy, could you touch your chin to your chest? Good. Then all the way back, look up towards the ceiling. Good. Straighten your head out. Then touch your chin over towards your shoulder. Good. Now the other side. You'll notice she's not lifting up her shoulder to do that. Good. And then can you just tilt your head towards one shoulder, now tilt it towards the other. Good. So the range of motion of the neck appears completely normal too. What I'm going to do next is come behind Nancy. And I'm going to do is palpate for the, first of all, the parotid salivary glands here. And if there was any, if there was mumps, these are the glands that get inflamed. And also palpate for the submandibular salivary glands there too. Good. And they don't seem to have any lumps or abnormalities. I'm next going to palpate for the various lymph nodes that could be present around the head and neck. So first we're going to palpate for the preauricular lymph nodes, the postauricular lymph nodes, the submental lymph nodes, submandibular, good, the anterior cervical, the posterior cervical are in the anterior border of the trapezius muscle. I'm going to feel for the supraclavicular lymph nodes. And could you lift your shoulders up a bit, Nancy? Good. And then finally, I'm also going to feel for the occipital lymph nodes. Okay. Good. And I don't feel any enlarged lymph nodes in any of those regions. Next part of the exam I'm going to do is to check for the trachea, which is your windpipe. So just looking straight across the room, Nancy, I'm just going to put my fingers at the bottom of your throat, and I can feel the trachea move back and forth easily between my fingers. So it is midline. Next part of the exam I'm going to do is check for your thyroid gland, which is a little butterfly-shaped gland that sits at the base of the neck here. To help me do that, I've got a cup of water here. Nancy, what I'll ask you to do is to take a sip of water, but hold it in your mouth
Okay.
while I get my hands in position here. I'm going to feel for the thyroid cartilage, which is here, and below it is the cricoid cartilage, the first rim of cartilage below that, and put my fingers lateral to that. And now can you swallow, Nancy? Okay, and I didn't feel your thyroid there. One more sip of water, I move my fingers a little bit lower. Do the same thing again, swallow. Good. I don't feel your thyroid to be enlarged or any nodularity to it. So that's good. And next we're going to do is to inspect your spine. So what I maybe could ask you to do, Nancy, is to sort of turn to the side. And could you undo your top gown there? Great. And so what I'm doing here is just to look at the spine itself and just gently palpating here. I can see that the spine is straight. And I see there's no overlying rash or abnormality. I also see that there's no scars on the back also. I'm going to ask you, Nancy, to take a couple of deeper breaths, and I'm just be checking your chest wall to see how your chest wall moves during normal breathing. So a few deeper breaths. Good. Again. And there appears to be normal respiration. I'm just going to put my hands around your lower rib cage here. And again, ask you to take a deep breath. Exhale. Again. And notice that folded tissue come and go with each respiration, which is normal. So again, that's appropriate respiratory motion there. Next thing I'm going to do is percuss the lungs. So Nancy, could you grab your shoulders? That action kind of helps to separate the scapula so there's more exposable lung field to percuss. Of course, I'm going to start at the top. Good. I'm going to do one area in front here, too. Put your arms down for this, actually. Good. So it appears to be normal percussion. I percuss 3 areas in back, 1 on the side, and 1 in front. Next, I'm going to check for fremitus. So, Nancy, each time I move my hands, can you say 99?
99.
Good.
99. 99. 99.
Good. And what I was checking for is a sense of vibration along my lateral hand there, and it was symmetric on both sides as I checked. Next I'm going to do is to listen to the lungs. And again, Nancy, could you grab your shoulders again? I'm going to ask you to take some breaths in and out through your mouth. And again, I'm just going to listen anteriorly in one spot here, too. Good. And it all sounds normal. You can go ahead and swing your feet back, Nancy.